Well, good afternoon. I'm Brian Hooker, and I am the speaker for this afternoon session regarding vaccine safety science. And just a little bit about me, I am science advisor for the Focus for Health Foundation, and I'm also a science advisor and a board member for Children's Health Defense. I'm also an advisory board member for Focus for Health. My PhD is in biochemical engineering, and I've worked in the biotechnology for about 35 years. And I also have been looking at the issues of vaccine safety for approximately the last 19 years. So I am excited about my presentation today. Rather than talking about other people's vaccine safety science, I'd like to talk about something that I've been working on directly. And so I'm going to share my screen. The title of my presentation is Vaccinated versus Unvaccinated Children and looking at health outcomes. So here goes. Okay, so I was almost correct. The official title is Health Outcomes of Vaccinated versus Unvaccinated Children. Let me put this up on screen show or slideshow. So anyhow, one of the things that is not difficult to notice is that we are surrounded by sick children. And about 54% of all children in the United States have been diagnosed with a chronic disorder. This is actually information from 2012, and that's up from about 12% that were diagnosed with a chronic disorder. And this was actually government data where they looked at 22 different chronic disorders, including obesity, and they found that since the 1980s, the amount of chronic disorders in the United States among children has risen from 12% to 54%. 1 in 6 children have been diagnosed with a neurodevelopmental disability. This would include ADD, ADHD, learning disabilities, speech and language disorders, and autism. And at least 1 in 54 children, and I'd say that this is a very, very conservative statistic for the United States, has been diagnosed with autism or an autism spectrum disorder. And there's been an explosive increase in these disorders since the early 1990s, which coincides with an explosive increase in the vaccination schedule. Okay, and so many people have been calling for a vaccinated versus unvaccinated children study. And despite multiple calls, especially within the community that's concerned about vaccine safety, US government officials refuse to do this comparison. There are no official comparisons that have been done. They claim that the data aren't available and that you can't find pockets of unvaccinated children or enough unvaccinated children to do a study. Okay, and this is false. Even the CDC's vaccine safety data link includes unvaccinated children. They also claim that the only useful study would be a double-blinded placebo study where vaccines would be withheld from some children without their knowledge. And they claim that this is ethically wrong. It's ethically wrong to vaccinate children with saline placebos. I would contend that you would not need that type of study. And even the CDC relies on a different type of study when they do the vaccine safety science. And so the gold standard is not a double-blinded prospective placebo study. It's instead what's called a retrospective study. And these are completed all the time, completed by the CDC, other HHS scientists, specifically the National Institutes of Health. And this serves as a gold standard for post-marketing surveillance for vaccine safety science. And so you don't need to do these types of studies and the data do exist for these types of studies to be done. So, why aren't you doing it? Okay, so there have been some independent vax versus unvax studies, a few that are in the format where they look at purely unvaccinated children and purely vaccinated children. And the most famous is the Mawson study. This was done in 2017. It was published in the Journal of Translational Science, and it was based on a parental survey of homeschooled children. So these were children that were exclusively homeschooled. And about 670 or so parents or children were actually included in the study. And it showed significant relationships for those children who were fully vaccinated or partially vaccinated versus those who were unvaccinated, and significantly more pneumonia, otitis media, which is ear infections, allergies, and neurodevelopmental disorders in vaccinated children when compared to unvaccinated children. Okay, and even in the Institute of Medicine report, there are multiple studies showing how multiple vaccinations versus unvaccinated individuals would lead to sudden unexpected death as well as type 1 diabetes. And this is a report that was done by the prestigious Institute of Medicine, now called the National Academy of Medicine, at the bequest of the federal government. And so they found this report and they actually included it in one of their own reports. Another Institute of Medicine report, this is sort of on the flip side, said that out of 158 types of vaccine adverse events, these were adverse events around 8 chosen vaccines chosen to be investigated. The vaccines were chosen by the CDC, and evidence was insufficient to judge a relationship in 135 of such of these events. So over 80% of the events, there wasn't enough information, there wasn't enough vaccine safety science to say whether the event occurred and was related to vaccines or if the event was unrelated to vaccines. And so there's this real hole in vaccine safety science, okay? But I've worked specifically with Bobby Kennedy Jr., and we've compiled a list of existing vax versus unvax studies. And this list is compiled as a PowerPoint presentation, which includes the abstracts and the highlights of each one of these studies. And we've seen fully 46 different studies where, to some extent, vaccinated versus unvaccinated populations were considered. And here's the web address. You can get the full presentation. It's actually now in, I believe, 9 or 10 parts. And you can get this full presentation on the Children's Health Defense website. So they do exist. Okay. Now, for the study that I was involved with, I was approached by individuals in what's called the Pediatric Health Outcomes Initiative, or PHOI. And this is a collaboration between physicians and scientists to investigate the relationship between vaccination and health outcomes in children. And so this was an excellent collaboration because we could directly interact with physicians and were able to access the data. And the PHOI is conducting both prospective, this is from a single date forward, where you follow vaccinated versus unvaccinated children, and retrospective studies where you go back and you look at medical records from existing children and existing medical practices. And the power of this was we were able to use chart data directly from medical practices. This was not necessarily based on parental survey. It was based on a medical diagnosis that was provided by a physician. And it was also based on vaccination records of children who were actually born and followed up continuously in these practices. Okay, and so 3 pediatric practices across the United States provided the patient data for the study that I am presenting today. The patients considered for the study were born between November 2005 to June 2015. The study, the analysis was completed in the summer of 2018. So the youngest children in this study were actually 3 years old, and the oldest children were about 13 years old. Okay, my co-author, I was very, very fortunate to collaborate with Neil Zell Miller, and he is a medical research journalist with 30 years experience in this area. He's written many, many books And here are his 5 vaccine safety books that I've listed. And Mr. Miller worked with me throughout the process of writing the paper and also advised on the analysis of the paper. Okay, he's also an author and co-author of about, I think, over 10 scientific papers that he's co-authored primarily with Dr. Gary Goldman. Okay, so looking at this particular study, we looked at a group of children, and in this group of children, we wanted to analyze to see if children who were vaccinated or partially vaccinated had more of an incidence of developmental delays, asthma, ear infections, gastrointestinal disorders, and then we used a control diagnosis of head injury. Now, presumably head injury is not related to vaccination status. So if we did see a relationship between vaccine status and head injury, then that would call all of our statistics into question. So we needed to include that control diagnosis in order to make sure that our information was valid. Okay, that was just one of many checks of the validity of the results that we received. And I wanted to show that these were actually based on medical diagnosis codes, ICD-9 and ICD-10 codes in the 3 medical practices. Okay, we started out with approximately 16,000 patients in these 3 pediatric practices, and we first excluded patients who were not born in these practices, and that eliminated about 12,000 individuals. The remaining patients were born within each practice, and with follow-up through June 2018, that included about 4,800 patients. Those that were outside of the specific age range, we didn't want children who were too old that may have followed a different vaccination schedule, and we didn't want children who were too young to get one of these diagnoses. That left a range of patients that were born between November 2005 and June 2015, approximately 2,000 patients. And we excluded these children if they received their diagnoses prior to their first birthday. And when we did this, the reason why we did this is we considered vaccination only during the first year of life. And then after the first year of life, we looked at what maladies and what conditions were diagnosed, because we wanted to make sure that vaccination preceded diagnosis and not the other way around. We didn't want to have an instance where individuals were diagnosed and then vaccinated afterwards. Okay, and so this left an analysis for our 5 different conditions studied, and again, about approximately 2,000 patients per analysis. Okay, and this gives some more demographic data. Over 3 years old in our sample that we had, left about 2,047 patients. Of these 2,047 patients, we were looking at vaccination before age 1. If a child was unvaccinated before age 1, in our study, they were considered unvaccinated. If a child was vaccinated before age 1, then they were considered vaccinated. And so this left 633 unvaccinated children compared to 14 vaccinated children. And of those unvaccinated children, that 633, we did find that some were vaccinated, about 103 were vaccinated after their first birthday. But again, because we wanted to stress the temporal relationship, vaccines first and then diagnosis later, these were considered unvaccinated within our study. And then I list all of the different maladies that we looked at, the frequency, developmental delay, about 10%, asthma, about 4%, ear infections, about 40% of the entire cohort had been diagnosed with at least 1 ear infection, and then gastrointestinal disorders, almost 6%, and head injury, about 7%. Okay, other demographics. The number of vaccines received by age 1, the mean was about 9 vaccines. And this is a very, very small amount compared to the actual CDC vaccination schedule. If you look at the CDC vaccination schedule, there's actually a requirement of 21 vaccines by the first birthday. And so even though these children were vaccinated, they were under-vaccinated compared to the CDC schedule. So we felt like this would bias our results towards the null hypothesis, towards not finding a relationship, because truly, compared to the CDC schedule, they weren't receiving as many vaccines. And also their age of their first vaccine was at 102 days, which is a little over 3 months of age. And this is very different than the CDC's recommendation that children receive the hepatitis B vaccine in their first year of life, and then subsequently get vaccines at 2 months, 4 months, et cetera. So again, this was more under-vaccinated, and these children were vaccinated later as compared to those that followed the CDC schedule. Their overall age of our cohort was 5.6 years. And the age in terms of different diagnoses are listed here. Developmental delays, asthma a little later, ear infections obviously earlier, and we did exclude a significant portion of children who had ear infections prior to their first birthday, gastrointestinal disorders at 1.8 years of age, and then head injury a little later at 2.8 years of age. Okay, for our statistical model, we used a logistic regression model, and this was used to evaluate each condition studied. The data were stratified such that when we did direct comparisons, we directly compared children only that were born in the same year of birth, so they were following roughly the same vaccination schedule. Also, we compared boys to boys, girls to girls only, and only within medical practices in order to account for differences perhaps in diagnoses between different medical practitioners. We did not have covariate data. We didn't have data, such as breastfeeding status or type of birth or gestational age, because at this particular point, we did not have direct patient demographic data. I'm not saying that those data didn't exist in the medical records, but at the way that we did the data mining, we just did not have covariates at that point in time. So we looked exclusively as our main variable being vaccination status. And vaccinated patients, again, received at least one vaccine prior to their first birthday plus 15 days. We added that 15 days because the CDC schedule does require vaccines right at 1 year of life. So we wanted to capture perhaps that number of vaccines that may have occurred at a well-child visit at 1 year of age. Unvaccinated patients received no vaccines prior to their first birthday plus 15 days. Okay, and then here are the results. And the way the results are listed, I've got vaccinated and unvaccinated cases versus the total amount of children in each of these cohorts, either vaccinated or unvaccinated. Then I report the odds ratio with a 95% confidence interval, and then the p-value. Now, the p-value is the probability that we that we obtain this particular relationship or this particular odds ratio by chance. Okay, if the p-value is very low, say less than 0.05, then we deem that relationship statistically significant. And you can see that in the case of developmental delays, asthma, and ear infections, this is considering both boys and girls together, we did obtain significant relationships, not for gastrointestinal disorders, and heavens no, not for head injury. Our odds ratios reflect the proportion of patients diagnosed that are vaccinated versus those unvaccinated, and are generally around 2 for developmental delays and ear infections, but we did see a much higher odds ratio of asthma, up at about 4.5, which means we saw 4.5 times more asthma diagnoses in the vaccinated group versus the unvaccinated group. Okay, when we looked at males only, we saw very similar results. Our asthma did jump up to 6.89, but it was still within a high level of confidence. And I should also point out that we only had 3 asthma cases in our unvaccinated, and sometimes that will cause the statistics to be a little less reliable. I would have loved to see that be 5 or more. But again, in this instance, unvaccinated children were not getting these diagnoses, even though there were 342 males in that particular cohort. Okay, in terms of females only, asthma was not significant. It rose just above the level of significance of 0.05, but ear infections and developmental delays were significant. Okay, then we also did what was called a quartile analysis because we wanted to look at the number of children that, or number of vaccines that children received during their first year of life to see if there was some type of dose response effect where we may see maladies more or less in children that were more highly vaccinated versus those children who received fewer vaccines. So we divided all the vaccinated children up into quartiles based on that first year of life. And these quartiles were compared directly to the unvaccinated group via logistic regression. Okay, and here's the quartile analysis. In quartile 1, this was about 25% of the vaccinated cohort. They received between 1 and 5 vaccines. Quartile 2 was 6 to 10 vaccines. Quartile 3, which was probably the mean or close to the mean or median number of vaccines, was between 11 and 12. And quartile 4 showed that this population was unvaccinated. The range was much, much higher, between 13 and 21 vaccines. And again, 21 vaccines is the recommended range by the CDC. And you can see that when children, and the results that are statistically significant are bolded. Okay, and you can see that when children received less vaccines, if they're in quartile 1, we did not see significant relationships. We did see tending towards significance, and now I didn't include the p-values here, but if your 95% confidence interval crosses 1 and goes below 1, then that means that it's not significant. If the 95% confidence interval stays above 1, then it means it is significant. Okay, so for quartile 1, we didn't achieve significance. We got very close with the ear infections. Quartile 2, we saw significance for the 3 maladies that we considered earlier: developmental delays, asthma, and ear infection. And then quartile 4 or 3 and 4, when we saw the most vaccinated children, then we started to see a relationship between vaccination and gastrointestinal disorders. So the more that children were being vaccinated in their first year of life as compared to unvaccinated children, then there was indeed a relationship with gastrointestinal disorders. For head injury or control diagnosis, no relationship, as is appropriate. Okay, we also did a temporal analysis, and here we looked at children who were vaccinated through their second birthday. Okay, and so we looked at children who received their first vaccine before 6 months, their first vaccine before 12 months, their first vaccine before 18 months, and their first vaccine before 24 months. Okay, and then each one of these groups was compared to unvaccinated children within the same time frame. Okay, and here's our temporal analysis, and you can see children who are vaccinated earlier, all of our conditions studied, except for head injury, we did see a statistically significant effect. And then as more vaccines were being delayed to 12, 18, and 24 months, then we lost the relationship for gastrointestinal disorders. Ear infection, the odds ratio stayed relatively the same, around 2.0, somewhere between 1.7 or 1.97 and 2.22. And then we saw an interesting phenomenon within developmental delays, where the ratio increased as we included, and that may be because we were including more children as we got up to 24 months. And then we saw kind of a different relationship with asthma. It was a little bit more scattered. Okay, and again, head injury, we did not see a statistically significant relationship. But again, more vaccines earlier showed definitely relationships and also brought a relationship in gastrointestinal disorders that we did not see previously. Okay, now finally, we want to repeat our main analysis, and that was just strictly looking at vaccinated versus unvaccinated children. And vaccinated being defined as at least one vaccine before their first birthday, unvaccinated, no vaccines before their first birthday. But we wanted to take our age cutoff to receive a diagnosis and make it higher. In our original analysis, we only included children that were 3 years of age or older, but we recognize that some diagnoses like developmental delays are made typically later, and in some cases much later than 3 years of age. So we raised our minimum age of the children in the practice to 5 years. This actually decreased our cohort size, but it did increase the chance that a child would get a diagnosis, say like asthma or developmental delays. Okay, vaccine status was again very, very similar to the first tables that I presented, was based on only vaccines in their first year of life. And here are the results. Okay, for children who are at least 5 years of age, we did see a relationship with developmental delays, asthma, and ear infections. And you can see from the p-values that these are statistically significant. And then also right on the edge of significance was gastrointestinal disorders with a p-value of 0.045. And I didn't feel the need, there are some statisticians that might say that you need to correct for multiple trials with what's called either the Bonferroni correction or the family pairs-wise correction, but that's only if you're looking at analyses that aren't related to each other. And all of these were related to each other, our maladies, and also in the same in vaccinated versus unvaccinated children. So therefore, it does not merit that we correct those p-values. So that is a significant relationship. Head injury, we did not see a significant relationship for, but again, as we corrected, then we saw similar results. Our asthma odds ratio is still very, very high, approaching 5.0. And so this is very similar to what we saw in our earlier study when we looked at children that were younger, upwards of either 3 years of age or up. Okay, so in summary, we saw consistent relationships between vaccination status, developmental delays, asthma, and ear infections. Okay, so we saw that within our original analysis with children 3 and up. We saw it within our quartile and our temporal analyses, where we looked at the number of vaccines as well as the age of the first vaccination. And then additional relationships were seen for gastrointestinal issues in the quartile analysis when we looked at more vaccines, and the temporal analysis when we looked at vaccines that were being given earlier. Okay, and we also saw this relationship. I should go back to that previous point. We saw that relationship when we limited the cohort to children who were ages 5 and up. We did see some healthy user bias. What this phenomenon means is that parents of children who may be diagnosed with things like developmental delays and asthma may start to vaccinate, but they may not fully vaccinate their children, or they may curtail vaccination after they receive some type of diagnosis. So children that are healthy, they continue to vaccinate. And so we did see some healthy user bias in the quartile analysis for developmental delays and asthma, where the odds ratios were actually higher for lower amounts of vaccination in quartile 2 and quartile 3. And all relationships were significant except for head injury, our control diagnosis, when patient follow-up age was 5 years of age or above. Okay, and again, we were very fortunate, and we wanted to make sure that this control diagnosis was included. We did not see a relationship with head injury. It was some type of discussion regarding healthcare seeking behavior, because unvaccinated families may not see their practitioners as often as vaccinated families. But again, our effect estimates, our odds ratios were much, much higher than what you would expect if the differences were just differences in healthcare seeking behavior. Okay, so how does this compare to past work? Mawson also saw a relationship between vaccination status, neurodevelopmental disorders, ear infections, and allergies. We did not look at allergies directly, but we did look at asthma. And an association between vaccination and developmental delays has been seen in multiple publications. The two I list here are more regarding thimerosal-containing vaccines and vaccines back in, the analysis was done on infants and children back before thimerosal was phased out of most childhood vaccines. Obviously, it still is in the flu shot that's given to children as young as 6 months of age and pregnant women. Okay, some of our study strengths. This was based on medical chart records. Okay, so these were actual medical diagnoses, had nothing to do with any type of patient survey. So we were able to minimize recall bias and were able to get actual patient data. All patients were continuously followed up for a minimum of 3 years from birth. So we knew that they were vaccinated. We knew how many vaccines they received. In 2 of the practices, we knew the types of vaccines, but the third practice, some of the coding and the charting precluded us knowing, was it an MMR, was it a live virus vaccine, was it something like DTaP that was an adjuvanted vaccine? So we did not know those differences. So we did our analysis based on the number of vaccinations. Vaccination status was also based on diagnostic codes from patient records. And healthcare seeking behavior was accounted for in the control diagnosis. So children who had received or sustained head injuries from unvaccinated children in some instances may have not seen their practitioner, but we did not see a statistically significant relationship between unvaccinated and vaccinated children. Some of our limitations, like I said, no attempt was made to differentiate between the different types of vaccines. And covariate data were not available, and this is something that we would like to expand upon in future analyses, because obviously some of these maladies are also going to be associated with birth weight, gestational age, as well as some patient and parent demographic data. So it would be nice to include that information as well. Vaccination status, because we wanted to do a temporal analysis and we wanted to make sure that vaccination was not preceded by diagnosis, then we only looked at vaccination prior to 1 year of age. So we did count some children who received vaccines after 1 year of age as unvaccinated. And what this does is it actually biases us towards not finding a relationship or towards the null hypothesis. And so the fact that we saw a relationship even strengthens our confidence in the relationships that we did see. Okay, and the small size and nature of the cohort was limited our ability to look at specific developmental disorders, which we are looking at in further research that we're planning on publishing. So we could not break down specific developmental delays like autism, ADHD, tics, and others. Interestingly enough, these practices that were friendly to unvaccinated families, we didn't see as much autism. We didn't see as much ADD and ADHD. So that in itself was quite interesting. Okay. This is, I'm very glad to say that this was published on May 27th, 2020, so about 3 months ago. And since it's been published, the paper has been one of the most read papers in the journal. And in fact, it's been read or downloaded over 148,000 times. So we're very, very excited about that. It is getting a lot of exposure, and this is also Sage Open Medicine, which is a journal that's indexed in the National Library of Medicine. Okay, so looking at vaccination and looking at just the dearth of vaccinated versus unvaccinated studies like the one that I published with Neil Miller, vaccination really is the great unknown, okay? The safety of the vaccination schedule is, along with individual vaccines, is woefully understudied. And even, and I reported this earlier, that the Institute of Medicine, when they looked at 154 different adverse reactions from just 8 different vaccines, there are 14 different vaccines, they had insufficient data to rule out relationships with adverse events in 138 of the reactions that were studied. They could not rule out a relationship between the DTaP vaccine and autism, despite the fact that the CDC lies and says that vaccines don't cause autism. There's just simply enough data in this particular instance, even in the Institute of Medicine's set and mind frame, so it cannot be ruled out. Okay, and another report by the U.S. Institute of Medicine, and I quote, says, no studies have compared the differences in health outcomes that some stakeholders questioned between entirely unimmunized population of children and fully immunized children. So there is a dearth of this information, and so by vaccinating, then you are participating in a grand medical experiment. And adverse events are not rare. A study that was commissioned by the CDC, by the Harvard Pilgrim Health Group, in order to automate their vaccine adverse events reporting system database. This is where physicians report vaccine adverse events. Okay, and out of 1.4 million vaccines given, there were over 35,000 potentially serious adverse events. And these were events that were reported only within the month of vaccination. So fully 2.6% of the vaccines given had some type of serious adverse events associated with it. Given the fact that this represented about 300,000 patients, if you look at the per patient ratio, it was actually as high as 10%. Okay, and the CDC refused to move forward with the Harvard Pilgrim information and did not renew the grant to automate VAERS. It's almost as if they're turning their heads away and not seeing, what is actually happening. VAERS is woefully underreported. There's only a few vaccine adverse reports that are made every month. And so we need more of this information, like what Harvard Pilgrim was trying to do. Okay. And CDC, just based on an outsider's view, the CDC just simply does not want to know this information. Okay, so my take-home messages: we did see relationships between vaccination, developmental delays, asthma, and ear infections. Children receiving more vaccines or vaccinated earlier were diagnosed with gastrointestinal issues. And obviously, much more study is needed to understand the long-term effects of vaccination in children. So we need further study. We need more study. Okay, and I included here in the recording that I'm making today, the website where you can download the full paper. The full paper isn't an open access journal, so the PDF of the paper is free. So please download that and share it far and wide. Okay, I'd like to acknowledge, obviously, my co-author, Neil Zell Miller at the Institute for Medical and Scientific Inquiry, Children's Health Defense, Pediatric Health Outcomes Initiative, also Focus for Health, who I'm also affiliated. And this is my son, and I thank you for your attention. And at this point, hopefully I'll be able to entertain some questions, and have a great afternoon.